Good morning everyone, it's Dr. Brace here and welcome to Facial Plastics Friday. Today I'll be talking about facial pigmentation. This is a problem that a lot of women struggle with and are concerned about, and we get asked all the time, what can we do about these brown spots on my face? So I guess first thing I'd like to do is break up the brown spots. There's a difference between solar lentigo, which is sunspots, the brown that comes from sun exposure, and melasma, which is usually a skin reaction to the sun or to some sort of hormonal change like pregnancy or medications. And then there's also post-inflammatory hyperpigmentation, which happens kind of like melasma, but it is a reaction in the skin to inflammation. So it could be from surgery, it could be from a burn, it could be from certain skin products that you use, and it causes a reaction where you get brownness. And then there are the skin lesions like pigmented moles, freckles, keratoses, and things like that, which are separate altogether. So if you do have facial pigmentation, it's important to figure out, or for your doctor to figure out, what you're dealing with. If it's melasma or post-inflammatory hyperpigmentation, the treatment options are a little bit different, because you don't want to do anything that will cause more inflammation, because you could just start a vicious circle where you get rid of the pigment through something like a CO2 laser, but then stimulate more pigment because of the CO2 laser. So the first line therapy for any sort of pigmentation is topical creams. And the classic one that has been used for decades is hydroquinone. And hydroquinone helps prevent the melanocytes, the pigment cells at the basal layer of your epidermis, from making pigment, from making melanin. This can work well on its own, but it works best if you pair it with something that will cause your skin to turn over faster or quicker, like a retinoid. So using retinol on your skin can help can be synergistic and help that hydroquinone work better. And then the third thing you can add is a corticosteroid. Because hydroquinone and retinols can be irritating to your skin, the corticosteroid can help settle it down. And so if somebody has hyperpigmentation, the first line treatment is always to try topical therapies. The thing to remember about topical therapies with hydroquinone, Litera, azelaic acid, kojic acid, all these things that are available, the thing to remember is that it's a marathon, not a sprint. And so it takes about 3 skin cycles for a product to show a clinical effect, and a skin cycle is 6 weeks. So you have to use your hydroquinone as prescribed every day for 18 weeks or close to 4 months before you're going to start to see a clinical result. And so I think this is where most people fall off the wagon, is they buy a skin product, they use it for 6 weeks, they're like, it's not doing anything, they switch to a different skin product, or they stop altogether, they look for a different treatment. But you have to remember, with skin pigmentation and creams, or anything on your skin that you're trying to treat with creams, you need to give it 3 skin cycles or 18 weeks of consistent use to see a result. So that's the topical part. The other part you can do are chemical peels. Again, if you have melasma or post-inflammatory hyperpigmentation, you have to be very careful with chemical peels, because you could end up inducing more pigment. And so these would be very light peels like Jesner solution, glycolic acid, salicylic acid, very, very light peels, and not the stronger chemical peels like trichloroacetic acid, unless it's very, very dilute. Along the same lines of a chemical peel, where you're trying to remove an upper layer of skin and help cycle that pigment out, you can do laser peels. And again, what the underlying problem is very important, because if you use a CO2 laser to remove your sun-damaged solar lentigo, you're going to get a great result. If you're somebody that has very reactive skin and you have melasma or post-inflammatory hyperpigmentation, and we do a CO2 laser, then you're probably going to get blotchy worsening of the pigment, and so it would be the wrong thing to do. So there's lots of different laser and light therapies. Broadband light, BBL or IPL, is one treatment option, usually best for solar lentigos. There are pico lasers, which would be my preferred and favorite way to treat this, and we don't have one here at Well Facial Plastics, but I refer people out all the time for pico, because pico laser is a different type of laser technology that uses sound waves to shatter the pigment. This is different than most lasers or intense pulse light, which uses heat from that light source that gets absorbed in the pigment and causes it to basically break down and flake off. And so if you have melasma or post-inflammatory hyperpigmentation, a very light laser like a pico laser, or a light laser like a neodymium YAG laser can be done very, very conservatively and help bring that pigment out. If you have sun damage that's caused the pigment, then a CO2 laser is fantastic. That's one of my favorite tools to help refresh somebody's skin. So besides the topical treatments, the chemical peels, the laser peels, and the intense pulse light, there's not much else you can do for pigment. Microneedling, radiofrequency, those things have very little effect on the melanin production in your skin. They may help your skin texture look better, but they're not going to really affect pigment. The topicals come in lots of different varieties, and there's lots of different non-hydroquinone topicals that you can use. And so it is a bit of a marathon, not a sprint. And what you have to remember with pigmentation, unless it is sun-induced pigmentation, is that everything is a management strategy, not an eraser and not a cure. So if you do have pigment that you get cleared up with a laser, you're going to have to manage that by wearing sunscreen, which is probably the most important thing with all pigment, is reducing the amount of solar exposure you get and sun exposure you get by wearing a good sunscreen with an SPF of at least 30, because anytime you get that sun on your skin, you're going to stimulate more pigment. So you're always kind of chasing your tail with this sort of problem. So I hope that is a little bit helpful. In summary, you can do skin creams, which is the first line treatment. Sunscreen would be very important in those skin creams for preventative means. You can do light chemical peels. You can do light therapies like intense pulse light or broadband light, and then there are different lasers, and not every laser is the same. You have to differentiate between whether your pigment is hormonal or melasma type pigment, if it's post-inflammatory hyperpigmentation from something inflammatory, or if it's solar lentigo or sun-induced pigmentation. So make sure you see an expert, and everybody have a great weekend and happy December. We're almost at Christmas. Bye-bye.